Welcome to the deep dive. So today we're going to focus on something really, really critical for Social Security disability insurance claims.
Yeah, something that comes up a lot for people trying to navigate the system.
Exactly. Consistent medical treatment. We've dug into why this piece of your medical past is, well, just so important when the SSA looks at your claim.
And what it means for you, if you're going through this.
Our mission today really is to break down why that consistency matters so much.
And hopefully give you some practical knowledge you can actually use to make your claim stronger, based on how the SSA tends to evaluate these things.
Okay, let's jump right in then. Why is consistency, this ongoing treatment, why is it the key thing?
Well, think of it like this. It's not just about having a doctor say, okay, you have X condition.
Right.
SSDI is really about how that condition stops you from being able to, work steadily.
Okay.
So consistent treatment over time, it builds this paper trail. It shows the condition isn't just a blip, it's long-term, it's ongoing.
It demonstrates the disabling nature of it, day in, day out.
Precisely. It shows the treatments you've tried, maybe what worked, what didn't, that whole story over months or even years.
So it's the long view they need.
Exactly. This longitudinal data, as they call it, is heavily, heavily relied upon by judges, by the SSA examiners, everywhere, really.
And without it, what happens then?
Well, then decisions might get based more on speculation, and that usually doesn't work out well for the applicant.
Okay.
Strong claims, the ones that tend to succeed, they're built on these ongoing medical relationships. They show maybe the condition is worsening, how you're responding to treatment or not responding.
And why you have the functional limits you say you have.
Yes, exactly. Connects the dots medically.
So when the SSA gets these records, what are they actually zooming in on? It's not just the dates of the visits, right?
Oh, definitely not. They look deeper. Like how often are you going? Are specialists involved? Experts for your specific condition?
Oh.
Are your doctors actually adjusting your treatment based on how you're doing?
Yeah.
Or is it just the same thing month after month?
Right. Are they actively trying to manage it?
And crucially, do diagnostic tests like MRIs, blood work, whatever's relevant, actually back up the symptoms you're reporting?
Objective evidence.
Objective evidence. And a big one, are you actually following the medical advice? Adherence is key.
That makes a lot of sense. They're piecing together the whole picture. Now, you hear about the SSA's Blue Book. How does consistent treatment tie into that?
Right. The Blue Book lists specific impairments. To meet one of those listings, which is one way to get approved, you usually need pretty specific evidence.
And consistency helps provide that.
Absolutely. The Blue Book guidelines often demand consistent evidence over time and those objective findings we just talked about.
Can you give an example?
Sure. Let's say there's a listing for a back condition that requires proof you can't walk effectively. Consistent notes from your orthopedist. Maybe physical therapy records detailing your struggles over months. Observations from exams. That builds the case for meeting that listing. It's not just one snapshot.
Got it. Now, the flip side, what about gaps? Life happens. People might miss appointments, maybe can't afford care for a bit.
Yeah, and that's a tough one. Gaps in treatment, especially, if they stretch out for 3 months, 6 months or more, that can definitely raise red flags.
Red flags like what? What do they assume?
Well, the SSA might look at that gap and think, maybe the condition wasn't actually that severe if they didn't need treatment.
Oh, right.
Or they might assume you got better during that time. Or even, sometimes unfairly, they might question your motivation, like maybe you weren't committed to getting better.
Wow, that feels harsh, especially if the reason was, say, losing insurance or not having transportation.
It is harsh. And those are very real barriers people face. The SSA expects someone who is truly disabled to be actively seeking treatment, trying to get relief.
But they understand someone who just can't.
They can, if it's explained and documented. That's the key. If you have gaps, you need to show you were trying to get care or document the reason why you couldn't. Keep records of clinic applications, financial issues, whatever the barrier was.
So documenting the effort is important too.
Very important. It helps explain those gaps and can protect your credibility.
Okay, let's connect this to RFC, residual functional capacity. That sounds pretty technical, but it seems important.
It is very important. RFC is basically the SSA's assessment of what you can still do physically and mentally on a sustained basis despite your impairments.
Like sitting, standing, lifting, focusing.
Exactly. All those work-related activities. Now, your own doctor's opinion on your RFC, offered on a specific form, carries a lot of weight.
But I sense a but.
But
Yeah.
that opinion needs to be backed up by the medical record, by that consistent pattern of care we've been talking about.
Oh.
If your doctor suddenly fills out an RFC form saying you can only sit for 15 minutes, but there's nothing in the previous months or years of notes showing consistent complaints or findings about sitting intolerance,
They might dismiss it.
they might give it less weight, yeah. They could see it as speculation, or maybe just the doctor trying to help, rather than a conclusion based on long-term clinical evidence.
So the consistency really bolsters the credibility of your doctor's assessment, too.
Absolutely. It's all interconnected.
Okay, so let's flip it back. We know gaps are bad. How exactly does consistent treatment make the medical evidence stronger? What are the specific benefits?
Well, first off, it creates that detailed, date-stamped history of your impairments. Clear timeline.
Right.
The progress notes track your symptoms. Are they getting worse? Are you having side effects from meds that also limit you? That all gets documented.
Okay, makes sense.
It also provides evidence of treatments you've tried that didn't work, failed interventions. That shows your condition is persistent, it's difficult to manage.
Which supports the disability claim.
Exactly. It provides the clinical justification for why you're saying you can't work. And it helps corroborate those things that are hard to measure objectively, like pain or fatigue. If you're consistently reporting severe fatigue at every visit for a year,
It's more believable than mentioning it once.
much more believable. It shows it's an ongoing, significant issue.
And I bet this becomes even more vital if you get denied initially and have to appeal.
Oh, absolutely. At a hearing before a judge, having that thick, consistent medical file gives your attorney and the judge so much more to work with. It paints a much clearer picture of the long-term disability.
You mentioned specialists earlier. Let's touch on that again. Why does seeing specialists, getting referrals, carry weight?
Well, a referral to a specialist, say a neurologist, an orthopedist, a rheumatologist, it signals something right away.
What's that?
It signals that your primary doctor believes your condition needs expert-level management. It suggests complexity or severity. And then, consistent treatment with that specialist, or maybe even multiple specialists who kind of agree on your limitations. That's powerful.
More compelling than just a family doctor's notes.
Generally, yes. The SSA tends to give more weight to opinions from specialists, especially when they're backed up by things like imaging, specialized tests, and notes showing their coordinating care, perhaps.
Okay. Now, what about conditions that are naturally up and down, like fibromyalgia or maybe MS, lupus, even depression, things that have flares and remissions? How does consistency work there?
That is a really important question, because those conditions can be tricky to document.
Right, because you might feel okay sometimes.
Exactly. But even with episodic conditions, the key is still chronic documentation. You need to keep up with follow-up appointments even when you're feeling relatively better.
Why is that?
Because those maintenance appointments document the ongoing nature of the condition. They track medication adjustments, they might catch subtle changes, and they show you're managing a long-term illness.
And documenting the flares, too, obviously.
Oh, definitely. You need records from when you're in a flare-up, showing the severity. But if your record only shows the worst moments, with big gaps in between...
They might think it's just occasional bad spells.
Precisely. A judge needs to see the chronic picture, even if there are periods of temporary improvement. They need to understand it's an ongoing battle that impacts your ability to work reliably.
Oh, okay, this is really clarifying. So for someone listening right now wanting to, make sure their record is as strong as possible, what are some practical tips? What should they be doing?
Okay, some actionable things. First, try to schedule follow-ups regularly. Every 2 to 3 months is a good rule of thumb, even if symptoms feel stable. Don't wait until things are terrible.
Proactive, not reactive.
Exactly. Second, keep a symptom journal. Write down how you feel day to day, what activities are hard, side effects. Share this with your doctor. It gives them concrete details for their notes.
Good idea.
Third, don't be afraid to ask your doctor to specifically document your functional limitations. If you can't sit for more than 15 minutes without pain, ask them to note that down. Patient reports or observed difficulty.
Be specific.
Be specific. Fourth, always try to get copies of your records. Keep your own file. And share everything with your attorney if you have one. And, maybe most crucial, never just stop treatment on your own because you feel better or worse or whatever. Always talk to your doctor first. Document that discussion.
That's solid advice. But what about the people who genuinely struggle to get care? The cost, the access barriers we mentioned.
Yeah, that's a huge reality. If affordability is the issue, look into community clinics, sliding scale providers. Sometimes hospitals have charity care programs. Health fairs can offer basic checks.
What about insurance options?
Definitely apply for Medicaid or state programs if you might be eligible. Every state has resources, though they vary.
And if regular appointments just aren't feasible?
Gather what you can. Records from any ER visits, urgent care trips, even pharmacy printouts showing you're getting prescriptions filled. It shows some level of ongoing medical need and attempts.
And document the struggle itself.
Yes. Document every attempt to get care, who you called, what happened, write it down. If you were denied for financial aid, keep the letter.
And tell your lawyer about these struggles.
Absolutely. Make sure your attorney knows about any financial or access barriers. They can explain this to the judge. Judges can be understanding, especially if the reasons for inconsistent treatment are well documented and credible.
Okay. So just to quickly recap some of those frequently asked questions we saw in the source material, what's that general frequency again?
Generally, aiming for every 2-3 months is a good baseline, more often if things are changing rapidly.
And a gap of a few months? Fatal flaw or possibly okay?
Possibly okay if you have a strong, documented reason for the gap. Don't just leave it unexplained.
Specialist care essential or just helpful?
Not always essential, but definitely helpful. It adds weight, particularly for complex conditions.
Best way to track symptoms between visits?
Symptom diary. Keep it detailed, bring it to appointments.
And seeing lots of different doctors, good, bad, indifferent.
It's okay if the records are consistent and tell a coherent story. But bouncing around without clear follow-through can sometimes muddy the waters. A consistent relationship with 1 or 2 main providers is often better, if possible.
This has been incredibly insightful. Really highlights how consistency isn't just a suggestion, it's foundational. So, wrapping up, what's the main thing you want listeners to walk away with?
I think the core message is just this. Consistent medical treatment is truly a cornerstone of a successful SSDI claim. It's about consciously, actively building that detailed, continuous medical story.
A story that shows the real ongoing impact of your condition.
Exactly. It demonstrates the severity, the persistence, and why you can't sustain work.
So, a final thought for everyone listening. Take a moment to think about your own medical treatment history. What story does it currently tell? And maybe more importantly, what steps can you take starting now to make sure that story accurately reflects your reality and really strengthens your claim going forward?
That's the key question.
That's our deep dive for today. Thanks for joining us.